Hey everyone, it's Dr. Mike. We're here for tip number 49 in our medical exercise training ebook series. And tip number 49 looks at the MET criteria. Now, when myself and Dr. Jeffrey Wright, the physical therapist that worked with me on the original medical exercise specialist workshop, we sat down and we started looking at protocols. We wanted to make sure that the medical exercise professional would not ever be put in danger of working with an inappropriate client. Folks, that's vitally important. We want to make sure that just because a client is referred by a doctor, therapist, or chiropractor, or self-refers, that you realize not every client is appropriate and there are signs and symptoms that indicate the client is not. That's what the criteria is all about. It's signs and symptoms that indicate this client isn't appropriate. They need more medical care. And also, let me mention this. In my 40 plus years being a physical therapist, I've received referrals from physicians that were for individuals that were not appropriate for physical therapy. They needed to go back to or receive more nursing services or more care from the doctor to make them medically stable enough to tolerate physical therapy. The same thing holds true for you as a medical exercise professional. We must make sure that we are diligent and we always stick to the idea of checking a client out first by an assessment, and in that assessment, looking for red flags and to make sure the client meets the criteria for their condition before we start working with that client. Client can say, I didn't like my physical therapist, I left. Client says, my insurance ran out, I came to see you. Doesn't mean the client is appropriate. And with that said, let me read tip number 49 to you. What are the MET criteria? The MET criteria are one of the most important components in the medical exercise training protocols or MET protocols. As determination of the client's appropriateness for medical exercise training services is an important consideration. The criteria outlined in each protocol establish parameters for specific conditions the client must meet to enter the MET program. A medical exercise professional can even modify a protocol for a specific client after discussion with the physician or therapist or chiropractor. So this says you can modify this protocol, but you have to talk to their doctor, therapist, or chiropractor because the protocols are designed to make sure nothing falls through the cracks, to make sure the client is safely managed. And folks, every aspect of medicine utilizes protocols. When medical providers start adjusting protocols, they do it based on their professional judgment. And I can guarantee you they've talked to other medical providers before they do it. With that said, in some instances, individuals in need of additional medical care will attempt to enter an MET program. And if the medical exercise professional follows the criteria, the probability of these clients entering the program is minimized. The criteria uses swelling, radiating pain, numbness, tingling, pain scales, strength levels, and range of motion, and other red flags as parameters to determine the appropriateness of the client to enter the MET program. The criteria ensure you stay out of trouble. And folks, I say that last sentence with all sincerity. We put the criteria in place to make sure you stayed out of trouble, to make sure you never work with that client that was inappropriate without you knowing it, and you work with that client and now the exercise exacerbated their condition. That now puts you in a position of professional liability. We never wanted that to happen. So we ask you to please adhere to the criteria very specifically for each condition and don't ignore it. It's easier to say, Mrs. Smith, I can't work with you. Let's send you back to your doctor or your therapist than to work with Mrs. Smith and her condition is exacerbated by what you've done. You've now got to explain that to her doctor, her therapist, to her and her family members, and maybe even to a court. So please, if you would, make sure you go over to met101ebook.com, download a free copy, and we'll see you in tip number 50.